A friend of mine saw my wrist monitor and it was high, and she looked at me, she said, "You're not driving anywhere. I'm calling 911. She called 911. They came and picked me up in Milan, and she said, "Where is she going? Is she going to Milan or where?" He said, "This lady is going to Jackson. Her doctors are over there."
Well, she came into the emergency room and became much less alert, to the point where when I saw her and was talking with her family, she was barely able to mumble that her name was Mary, could not use the left side at all, was getting sleepier by the minute. And one of the real ominous signs for us in neuro is a change in level of consciousness. And the fact that this was so early in her course and she was so drowsy, we felt like surgery was the best option. In most cases, someone with the hemorrhage and the procedure that Ms. Morgan had would take weeks to get where she got within a matter of 3 or 4 days.
They told me I had a stroke and that I had a blood clot the size of a tennis ball. Dr. Neblett saved my life. And when I asked him to come in, and I wanted to hold the hand of the man that saved my life, and he said, and I said, "Yes, but you were here. Everyone was where they were supposed to be."
West Tennessee Neurosciences, we have 3 neurosurgeons currently and many neurologists, each of which have separate interests. I think the nice thing about a community this size is that we have so many doctors who cover so many areas of neurology and neurosurgery that we can provide nearly every service needed for a community this size, especially. That's nice. And the fact that it is a small town atmosphere, so that there's a personal interest taken, trying to treat patients like we'd want to be treated or have members of our family treated. It starts in the emergency room, the physician who saw her in the emergency room, the staff that takes care of her, initiating treatment, getting the studies done, my part, but the nurses' part in ICU, ER, OR. We just have a real good team, I think, at West Tennessee Healthcare and in West Tennessee Neurosciences, and it's a team effort that makes it all work.
I feel wonderful. I do anything that I want to do. The West Tennessee Neuroscience team, I would recommend treatment there. It is a life-changing experience to have a stroke, and it's a life-changing experience to have it treated and to feel that you are normal again.